Good day. My name is Gloria Iyawa, and I'm part of the PAICTA team with team members Atli Gamundani and Eriki Ipumbo. We were funded by the Hash team to undertake a project focused on machine learning for identifying teenage patients at risk of gestational hypertension.
Welcome. Today we are going to discuss the project that we have carried out titled Machine Learning to Identify Teenage Patients at a Risk of Gestational Hypertension. So what is gestational hypertension? Gestational hypertension is a form of higher blood pressure during pregnancies. This higher blood pressure during pregnancies poses a risk of less blood flowing into the placenta. If the blood flowing does not enough, so the fetus might receive less oxygen, fewer nutrients, which can lead to slow growth, low birth weight, or premature birth. Untreated gestational hypertension can cause serious health problems like kidney, liver, and brain damage to the teenage or mothers. I'm going to cover the objective, the benefit, the motive of the project. Then I'm going to describe the AI solution that we have created, the impact, the challenges, as well as the next step within the project. So we are starting with the problem that we are aiming to solve. So we aim to develop a machine learning for identify teenage patients at a risk of gestational hypertension by comparing the prediction performance of the 9 classification models. So who are the primary beneficiary for the project? So the primary beneficiary are the teenage pregnant women in the Sub-Saharan Africa, healthcare providers, as well as the broad healthcare system. The motive to undertake the project: we were motivated by a higher rate of gestational hypertension among teenage mothers in Sub-Saharan Africa and the need to innovate the solution to improve the mental health outcome. Our AI solution is to provide a solution that involves the development of 9 binary classification models, which are decision juggle, logistic regression, random forest, boosted decision tree, support vector machine, nerve bias, k nearest neighbor, average perceptron, and neural network. The development process includes data collection, model training, rigorous performance evaluation. So we entrusted inclusivity, responsibility, and involve a diverse stakeholder to maintain transparency and adhering to AI practices. The project impact: so our project has a significant to improve the early detection and management of gestational hypertension, leading to better mental and maternal as well as the neonatal health outcome. We anticipate a further reduction in maternal mortality rates, a wider range adoption of AI-driven in healthcare solutions. As we carry out this project, we have encountered some key challenges, and the most crucial challenges include the data quality and data accessibility. So the integration with the existing healthcare system to ensure a trust AI prediction. So we learned the importance of the stakeholder engagement and continuous model evaluation adaptability. So to end on the challenges, the second challenging is that most of the healthcare, they don't have databases where they keep the patient records, where most of the records they are on papers and the way they are structured is not quite well. So the next step in the project will include the scaling solution to more regions, integrating with the national care program, and to continuously improve the AI model with new data. The benefit we have encountered being part of the HASH network. So being part of the HASH network provided us with the valuable resources, expert guidance, and collaborative platform to accelerate the project development and its impact. Welcome, my name is Eriki Ipumbu for this project titled Machine Learning for Identifying Teenage Patients at a Risk of Gestational Hypertension. We compare the prediction performance of 9 classification models to see which one performed better than the others. The clinical dataset related to teenage patients from the Namibian context were gathered, trained using the 9 binary classification models, which are decision juggle, logistic regression, random forest, boosted decision tree, support vector machine, Navi bias, K nearest neighbor, average perceptron, as well as neural network. The machine learning model follows the data science best practice. This model aims to contribute to an early stage identification of gestational hypertension related complication among the teenage mothers. To identify the best model for diagnosing gestational hypertension, it is crucial to consider the matrices that align with the problem priorities. In this case, recall is particularly important because it measures the model ability to correctly identify positive cases, for instance, true positive of gestational hypertension. Higher recall means fewer false negatives, which is critical in medical context, where missing a diagnosis can have a serious consequence. Among these models, the Navi bias classifier has the highest recall, making it the best choice to identify gestational hypertension based on this matrix. Its F1 score and accuracy are also relatively balanced, which suggests it performs consistently well across different evaluation criteria. Even though some other models like logistic regression have a higher accuracy, their recall is much lower, indicating they might miss more cases of gestational hypertension. Therefore, for this project, Navi bias classifier is the most suitable option. This 9 classification model in which Navi bias was selected due to its performance. When you can see on my screen here, you can see the performance of the 9 classification models in which the Navi bias have a higher recall compared to the other models that were used. So to continue in this, after the Navi bias was selected, the machine learning model was developed to predict gestational hypertension. This machine learning follows the AI protocol and data science best practice. As you can see, for this machine learning to predict, it requires the input from the patients before it makes the prediction. So I'm going to demonstrate how it works. Okay, I'm going to demonstrate on how this model works when it comes to predicting the positive or negative cases of gestational hypertension. So to start with, let me start. So I would like to continue as the system is prompting me to. Then I will start. I'm entering the age, which is 20, then the gravida, which is 1, then I will enter the para, which is 0, then the temperature I will take 36, then I will take the pulse of 120, then I will enter the respiration of 20, the blood pressure I will take 146, then the hemoglobin it's 8, the glucose test, I take 4.8, and the weight I'll take 70. So as you can see there, the positive cases was predicted by the model. So we'll continue to enter another one for demonstration purposes. So I will say yes, I would like to continue. So then I will enter the age 18, then gravida 1, para 0, then I'll enter the temperature of 38, then the pulse of 120, the respiration of 20, the blood pressure of 126, then the hemoglobin of 6, glucose test of 5, and the weight of 69. Then I press enter. So another positive cases was recorded by this model. So this was the demonstration purposes. If we input another case which is of a negative, then the model can able to do so. We would like to acknowledge the support from the International Development Research Center, Artificial Intelligence for Development, Microsoft Africa Research Institute, Academy for Health Innovation and Infectious Diseases Institute, AI and AI Research Lab at the College, and Computing and Information System.